Good day, everybody. Um, I'm going to speak about the control of the estrus cycle in the dog. The female canine is called the bitch. So I'm going to expand on issues that lead to the control of the estrus cycle in the bitch. Number one, the control is done to prevent unwanted pregnancies. Number two, is for health management of the dog during the estrus cycle. Also is done for behavioral related issues. That's number three. And number four, for breeding management. And number five is done for dog owner convenience. Now, there are a number of risks of heat in the beach which make it necessary for the estrus cycle to be controlled. And one of these is pyometra. Number two, mammary tumors and cancer. Number C, intact beaches require around-the-clock care and vigilance when they are on heat. Now, let me expound briefly on the methods that are available for estrus management in the beach. Number one, there is a procedure which is surgical. It's commonly referred technically as ovariosterectomy or commonly as spay. This is the gold standard for estrus management in the beach. There are also medical or hormonal methods that are available, but these ones are risky. I'll talk about the issues later. And then number C, physical separation. When the owners consider none of the above two methods, then they can physically separate the beach. But in this case, hygiene and accidental pregnancies need to be put in mind. Now, in heat management in the beach, spay is the default option. When the option is to breed, then the focus must be on the health of the beach. Spay is a permanent solution for the heat cycles, while hormonal or separation methods are temporary. This difference must be emphasized to dog owners. Now, the methods in detail: spay or ovariosterectomy is for non-breeding beaches. It's actually the surgical removal of the uterus and ovaries and prevents the heat cycle. It also prevents pregnancy and also prevents forced pregnancies for good. That is throughout the health of the life of the bitch. It also will eliminate the risk of pyometra for good. It cuts back on the risk of mammary tumors significantly, about 99%, if it's done before the first heat. Now, the risk of a hysterectomy, it's about 5%. There is about 5% surgical risk for some bitches, depending on the health at surgery, experience of the vet doing the operation, and the equipment available at the disposal of the veterinary doctor. Now, later in old age, some spay bitches may experience urinary incontinence. There are a number of reasons which might lead to this, but it's important for the veterinary surgeon who is doing the operation to explain to the bitch owner that later in life some bitches may have this urinary incontinence. Otherwise, it's a very safe procedure when done by a qualified and experienced veterinary surgeon. Now, number B, hormonal methods.